At an airport in Belgium, medical supplies including masks and gloves are being loaded onto a cargo flight. Their destination, Africa. But as the World Health Organization warns the continent could become the next epicenter of the coronavirus pandemic, a Reuters survey has revealed gaping holes in the continent's health care, and not just in terms of personal protective equipment. Take intensive care beds. Reuters polling found there's less than one intensive care bed per 100,000 people in Africa. That's around 9,800. But analysis of scientific projections suggests that even in a best-case scenario, at least 10 times that number could be needed at the height of Africa's pandemic. The amount of ICU beds also varies widely. Chad, an oil-rich but impoverished nation of 15 million people, has only 10, whereas Mauritius, a financial hub home to 1.2 million, has 121. The same is true of ventilators. Across the continent, there are 9,300, but a third are in South Africa, with many in private hospitals. Some nations, such as Guinea-Bissau, have none at all. Mauritania has 1, Liberia says it has 6, Somalia has 19. Those ventilators need an oxygen supply, but the survey found a shortfall there as well. Kenya, for example, has nearly 300 ventilators, but a critical shortage of oxygen, according to a Senate report. Africa has recorded over 51,000 COVID-19 cases so far, a fraction of the estimated 3.8 million globally. But low levels of testing make it impossible to know the true scale of infection. The United Nations Economic Commission for Africa has said the continent could see nearly 123 million cases this year, causing 300,000 deaths. Testing capacity has expanded sharply, but the continent has still carried out only around 685 tests per million people, according to a tally of figures from the Africa Centers for Disease Control and Prevention. By comparison, Europe has carried out just under 23,000 per million. As John Nkengasong, director of the Africa CDC, has said, if you don't test, you don't find.